Hello, I'm Dr. John O'Mahony. Good evening. Thanks for joining us tonight. Tonight we're talking about CMV vaccinations, and we're doing a vaccine trial at the moment. So we want to give some people some information, get some experts discussing it. We're going to have a two-way conversation tonight between myself and Kayla NcNcally from the CMV Foundation. Dr. Peterson's not available tonight. He's on a well-deserved vacation. So I'll be starting off with Kayla. So Kayla, thanks for joining today.
Hi, thank you so much for having me. It's great to be here.
Thanks. Can you just tell us a bit about the Canadian CMV Foundation?
Yeah, so we're a national charity committed to preventing congenital CMV or cytomegalovirus infections and improving quality of life and care for those who have been affected across Canada.
Okay, so I think a lot of we've been doing some awareness over the last couple of months about CMV. Unfortunately, I have a few patients over the last couple of years who've had babies who've been born with CMV, and again, totally taken by surprise by the mothers. They felt fine throughout their pregnancies. So we can just talk about what is CMV. I mean, for me, it's when we talk about it, it's a common virus, so it's called cytomegalovirus. The stats are about 1 in 3 children under 5 will have had CMV or be exposed to CMV, and approximately 50% of people by the age of 40 have also been infected with CMV. Are those the numbers that you would quote?
Yeah, no, that's right. It's extremely common, and yet we know that most people have never even heard of it. I think part of the reason is probably the fact that the virus, and if you're otherwise healthy, is generally very mild. A lot of people have no symptoms, but the work that we do is really around congenital CMV. So if you are pregnant, CMV is cause for concern because the virus can be passed to your baby and cause a wide range of different effects.
Yeah, so when people often say, if you think 1 in 3 children under 5 carry it, and you're a young mother with a child at home and you're changing diapers, first of all, people ask, how is it transmitted? And it's transmitted through bodily fluids, saliva, through urine. So you're changing diapers, you're giving kisses to your baby, back and forth. It's pretty easy to pass on CMV, and especially with families who have couple kids in daycare. We see these in households, and if you were pregnant, and you can certainly pass it on. That's what we're discussing when we say congenital CMV. So the stats, Kayla, for children born in Canada, I believe it was 1 in 200 children are born with CMV in Canada.
That's right. And
Yeah.
I think it's important to note that most children who are born with congenital CMV will be fine. They'll have very little or no symptoms. But we know that about 20% or 1 in 5 of those who are infected will develop lifelong disabilities. And this can range anywhere from hearing loss, things like cerebral palsy, microcephaly, and in some cases, the infection is fatal. So it is very serious and it is very common.
Yeah. So we often know the question is, what can you do to prevent transmission of CMV, especially as you were saying, if you are pregnant? And obviously the common things we hear about are certainly hand washing and like personal hygiene at home. Any other suggestions that you tell families?
Yeah, I mean, that's a lot of things that we're kind of used to with COVID now, washing your hands frequently. Like you mentioned, it's passed through saliva and urine. So if you have a little one at home, it's things like not sharing food, drinks, utensils, maybe kissing them on the forehead instead of the lips. Making sure to be really diligent about hand washing after diaper changes or disinfecting toys and surfaces that might come in contact with a little one's saliva.
Yeah, I mean, I don't know how many times in my office I've seen a soother being taken out of the child's mouth and put into the parent's mouth and then back in again. So I think it's a common thing that happens, and yeah, so you can certainly see how it would happen in families like that. So why we're here tonight is we are talking. Besides the prevention, all the common things we said to do at home, there is a lot of research being done into vaccines for viruses, especially after everything we've been through with COVID, especially with the mRNA virus vaccines. And we are working with Moderna on a vaccine trial that's we've been going now for about 3 or 4 weeks now. We have about 15 mothers and women who have actually signed up for the trial. So it's great. So we're getting a lot of good feedback. And we actually have 50 spots that have been held for us, which is great. So we expect them to fill up pretty quickly. So we just want to make people aware that there are things you can do. You can be proactive. And what's interesting about this trial is that, it's obviously focusing on women of childbearing age, so women between 18 and 40. And you have to have contact with somebody under 5 in your home. And we kind of know why that is now, because we know that 1 in 3 children under 5 will have had CMV. So you're more at risk to get CMV from your own children if you're pregnant. So that's why in this trial, that's what we're looking for. So we're looking for mothers, or not mothers, women of childbearing potential, somebody who's not planning on getting pregnant in the next 9 months. Now, you can get pregnant throughout this trial because we observe you for 30 months throughout the trial. There's 2 arms of the trial, so most clinical trials will have a placebo arm. And what we really want to do is compare. And so half of the population will be getting the active vaccine, the other half will get a placebo. And we'll be just checking your serology throughout that time to see if you've been exposed to CMV throughout the time of the 30 months of the trial. And with the hope that those who receive the vaccine will have lower titers, will have less exposure. If you do get pregnant during the trial, will also be there's the option, if you'd like to, for us to also check titers for the baby after the baby's born. So it's a very interesting trial. It's getting exposure, hopefully, to a vaccine that's effective prior to it being available to the general population. So we really see the future, hopefully the next 2 or 3 years, that we're going to see a vaccine that's readily available for all women of childbearing age in Canada. Kayla, I don't know if the information you're hearing out on from the research end, anything exciting that you're hearing about?
Yeah, well, I mean, we're very excited about the prospect of a vaccine. I think when the Canadian CMV Foundation was first formed back in 2013, 2014, they were told that we were decades away, many, many years away from a vaccine. So to know that something is on the horizon in the next couple of years is very exciting. I think it's just a really exciting time in the CMV space in general. There's a lot happening around newborn screening. I know you're in Ontario, I'm in Ontario as well. In 2019, Ontario became the first Canadian province and actually the first region in the world to implement a universal newborn screening program for CMV. So every baby who's born here in Ontario is now screened for CMV at birth. This year in 2022, Saskatchewan became the second province to adopt a program like that. And we're really engaged in advocacy across Canada to ensure that screening will happen all across our country. So I think there's a lot of momentum being built in the space, and a vaccine will just really propel us to a place where hopefully hardly any children are born with congenital CMV one day.
Yeah, that'll be the goal. In a few years will be something that just, like there's a lot of vaccines. We know that, certain vaccines like COVID, we've been doing boosters, and we don't know where this one will lead us, but we're certainly, it's leading edge what we're doing right now. We're excited about it, and we're happy that it can be available to anybody in our region who wants to get involved. So any other questions or anything else you'd like to share? Just any call outs for your foundation, or anything else that you think we should share with our audience tonight?
I would just say, if you're a parent out there, if you have a child who is born with congenital CMV, or if you're just someone who's interested, I would encourage you to reach out to us. Our website is cmvcanada.com. You can reach out to us by email, info@cmvcanada.com. We have a lot of resources for parents, for families, and ways for people to get involved. And if you're a healthcare provider out there who's watching, I would encourage you to have conversations with your patients about CMV. The number one thing that we hear from families is, why did no one tell us about this sooner? There are very simple prevention strategies that can be put in place. It's so common. There are treatment options that are available, a lot of interventions and therapies that can be put in place if we identify these infections early. And parents just want to know. Knowledge is power. So if you're a healthcare provider out there, we have tools and resources that can help you have those conversations with your patients. And if you have any questions, feel free to reach out to us.
Okay, appreciate that. And if you want to learn more about our trial, so it's www.bwcmv.ca, and you can fill out a form, and our study team will be in contact with you within 24 hours. On the weekend, it'll be first thing on Monday morning. Our numbers, I hope, are behind me. Yes, 519-344-6612, and our website. And I'm happy to speak with you. Come in for an appointment. We can do a telephone appointment, answer any questions that you may have. And again, we're very thankful to Kayla for spending time with us tonight and helping us learn more about CMV. So thank you, everybody.
Thank you.